First of all, I wish you all a very happy World Homeopathy Day. I, as well as I think we all should thank to our organizer, Dr. Suman Haldar, to organize such a unique way, such a unique way, our master's birthday. Though I am a bit nervous to present my paper in front of my seniors and my teacher, as well as I am very much confident. If I make any mistake, they will correct me. It will always helpful for me as well as you also. My dear friends, as there is network problem in my area, so I will conclude my presentation as soon as possible. As organizer told me that I should consider more, this presentation is more for novice young homeopaths. So let's start our presentation over the kidney stone, nephrolithiasis or urolithiasis. An observational study was undertaken with an objective to ascertain the usefulness of homeopathic medicines in the treatment of renal calculi where size of at least one stone more than 7 mm. Why 7 mm? Because less than 5 other system of medicine believe is to stone size less than 5 mm pass automatically. So I take the cases more than 7 mm. It may be a valuable paper in the field of homeopathy. It helps us to establish the role of homeopathy in surgical disease like renal stone where size of stone matters. My dear friends, the efficacy of homeopathic in renal stone is a very much established fact among our community. You ask anyone in our community, name the medicine for kidney stone. Out of 100, 80% people will tell you the name of Berberis vulgaris. Such a popular medicine. Later we will discuss Berberis vulgaris. But before that, this is the condition, that is kidney stone conditions, where doctors and physicians of other system of medicines also cases they refer to us. For if you have a kidney stone, go to a homeopath. So such a image among the community for the homeopathy in cases of kidney stone. So I took this challenge because I got lots of failure during my early stage. So it's a right time to discuss with you my experience, whatever I learned from my teachers, my seniors, and from my patients. This is one of the case record. And before I proceed, I must know there will be one question which comes in your mind, whether such a big stone can pass or not. I'm sure this is a very common question. The objective of this paper is to establish the definite and positive role of homeopathy among the homeopaths also, that yes, we can. And before I proceed, I would like to share a few pictures. A stone of 16.9 mm, kidney stone size 13 mm, 9 mm, 10 mm, 8 mm. My dear friends, as this presentation is for novice physician, so they are the two different conditions. One, a patient all of a sudden renal colic occurs and he visited to his some doctor and he prescribed some injection or some painkiller, and after this treatment somebody advised him go take homeopathic medicine. Homeopathic medicines are very effective for kidney stone. This is the one condition. And the second condition, with the same patient during your treatment got renal colic. Now you cannot say no, we cannot treat your acute conditions. You just go and again take this painkiller. My dear friends, in my clinical experience, especially two disease conditions, one is kidney stone and other is migraine, where a homeopath required very much depth of knowledge to treat both acute and chronic cases with confidence. Number one thing. Number second, that is a very important point. Whatever school you follow, whatever angle of your prescription, whether you take the whole case of on the basis of generalities, constitutional treatment, totality, or you follow STME, whatever, in these conditions of migraine and kidney stone, you required all this knowledge. Yes. So how to take these cases? That is the important question. Why? What are the questions we should ask if a patient comes to us after taking some painkiller? And I will always give one clue to selection of the medicine. So first is what is the presenting complaint, and after the presenting complaint, we will take हिस्ट्री ऑफ प्रेजेंटिंग कंप्लेन, दैट इज ऑनसेट ऑफ सिम्टम्स, पेन कब शुरू हुआ, कितने दिन से है, ड्यूरेशन, एंड व्हाट इज द सीवियरिटी, दर्द के साथ क्या क्या हुआ, उल्टी हुई, वोमिटिंग हुआ, कितने देर रहा, दर्द धीरे धीरे शुरू हुआ या एकदम से हुआ, बढ़ता था घटता था, उसके साथ आपकी यूरिन की फ्रीक्वेंसी कैसी थी, कैसे आपको आराम मिल रहा था, उल्टी हो जाने से, पेशाब कर लेने से, और इससे प्रीवियस एपिसोड्स ऑफ द सिम्टम्स या इससे पहले भी, व्हाट आर द की सिम्टम्स जिसके बेसिस पे हमारे सीनियर डॉक्टर्स कैन डायग्नोस, यस दिस इज द केस ऑफ renal colic. These are the key symptoms, that is dysuria, about the frequency, urgency, uria, hematuria, hesitancy and terminal dribbling, poor urinary stream, urinary incontinence. In some cases, there is fever, rigors, nausea, and vomiting. Now, again, like in other cases, the importance of past history, that previous urological disease, other medical history, surgical history, especially for structured urethra. Drug history. Why drug history is important? Because formation of drug history or personal history, whatever you want, formation of renal stones include antacid, carbonic anhydrase inhibitors, sodium and calcium containing medications, vitamin C and D use is very common in our these days in our country, and this is the one of the commonest cause for the stone formations. Antibiotic exposure for recurrent UTI like ofloxacin can cause kidney stone. This is the very important. So we must take, while we are asking in case of kidney stone, we must take these points. We must consider these points. Family history is definitely important. There is as strong families, there is always chance of a kidney stone. Then personal history, but that is your habit, your desire, your aversion. A higher protein diet with more protein, that we will ask in a desire aversion associated with higher incidence of stones. This is secondary to the increased prevalence of hypouricosuria, hypercalciuria associated with that. Desire for extra salt and leads higher salt intake is associated with higher urinary sodium and calcium levels and decreased urinary citrate. This promotes calcium salt crystallization due to urinary saturation of monosodium urate and calcium oxalate, calcium phosphate being increased. Salt excess can lead to bone loss, therefore worsening this situation. Smoking history, alcohol intake, home situation. If person is alone, that sedentary lifestyle always create a problem. Functional problem. Occupation. If a person is having sedentary lifestyle, sitting in AC room, there's a low urine output. That is the occupation. Why we ask this question? We ask like IT specialist is sitting in our chamber. This is the one of the reason. Or a person who is doing regularly gym. It is also a cause for the kidney stone. Or taking this protein diet for muscles pain, for muscles, developing muscles. A low urine output due to increased intake of fluids and sedentary long working hours can produce a higher concentration of urinary solutes, therefore leading to a stone formation. Seasonal variation, that is systematic generation. And the key thing is active listening. That that in 83, 84, 85 aphorism, our master said that is very important. And that the objective symptoms. If a patient suddenly comes to your clinic, how our seniors diagnose this case, and here again the importance of both subjective and important symptoms, but objective symptoms also very important in cases of acute renal cases. That acute severe flank pain that radiates to the ipsilateral groin, asymptomatic sometimes, as stone passes get lost in the distal